In downtown Monrovia, traffic jams are back again since a long time, which is a sign that Liberia has come a long distance. Since 2003 and the end of a series of civil wars that killed nearly 250,000 people in 14 years, the country has been slowly rebuilt. Today, only the strong presence of UNMIL vehicles and the UN mission in Liberia in traffic is a reminder that the country is trying to consolidate a fragile peace. Now led by Ellen Johnson Sirleaf, the only woman to preside over a state in Africa, Liberia implements development programs. And among these programs, health occupies a prominent place. The government attaches great importance to the health of women and the fight against malaria.
Liberia is one of the countries that most affected. First of all, malaria is one of the biggest killers in our country, particularly of children and women. And also maternal mortality. Liberia has a very high level, so we have to work extra hard to be able to improve the health situation and to keep our women alive.
Like Liberia, many African countries are making efforts to fight against maternal mortality. But statistics do not plead for the moment in favor of a greater consideration of the health of women on the continent. To achieve MDG 5, which aims to reduce 75% of maternal mortality between 1990 and 2015, the continent must achieve an annual reduction of 5.5% of maternal mortality. Between 1990 and 2000, Africa was able to reach only a rate of 2.7%. Maternal mortality occurs currently in Africa out of 480 births per 100,000 live births against only 20 per 100,000 live births in Europe. This bleak picture is painted by the first report on the health of women in Africa, addressing the challenge of women's health in Africa, written by a committee established by the WHO Regional Office for Africa.
Notre commission, qui a été très bien documentée depuis plusieurs années,
Our commission, which has been well documented over the past few years, was a multidisciplinary commission comprised of economists, gynecologists, pediatricians, social medicine specialists, etc. Well, we have tried to document the situation of the health of women in Africa, and we have tried to see the strategies. Why, despite all the efforts by African women, maternal and child mortality keep increasing in Africa? So we have seen that there are cost-efficient, practical and efficient strategies, but which are not applied in all the areas, and we have suggested that these strategies be applied. We have also seen that there are some preventive strategies likely to reduce maternal mortality, such as family planning, etc., that are not used.
According to the report issued by Madam Ellen Johnson Sirleaf, President of Liberia and the Commission of Women's Health in the African region, the situation of maternal mortality on the continent is the combination of factors. First, there is the inability of the majority of African countries to provide quality health care. There is also the use of direct payment of health care that discourages most women to use the services of specialists. Finally, there are very important sociological factors.
La société crée des conditions sociales de reproduction de la vulnérabilité.
When it comes to health, the community creates the social conditions for the social reproduction of women's vulnerability. First, there are gender inequities. Gender inequities lead to unequal access to resources, enabling the handling of health-related issues. Most of the time, the woman doesn't have the largest resources within the household, and at the same time, she is in charge of the daily handling of health-related issues within the household. So as you can see, this is a curious situation in which she has to take care of food and health needs, both for the children and adults, And oftentimes, she forgets herself in terms of her own health care. So these gender inequities are at times ignored or reinforced by laws that are outdated or no longer relevant when it comes to addressing these issues. These are elements to be taken into account, but at the same time, the sociological and anthropological analysis highlights that there are some cultural resources that can be mobilized and given back for an improvement of the situation of women. And at this level, the African woman claims a solid background of addressing economic and social issues in our communities.
Des problèmes économiques et des problèmes sociaux dans nos sociétés.
Nous avons vu en fait que ce n'est pas seulement les causes.
We have seen that these are not just the causes that kill women, but the context-related causes and factors play a key role in maternal mortality in Africa. And we believe that only when we are able to put together and coordinate all these strategies will we be able to have significant outcomes in terms of reducing maternal mortality in Africa. The report in itself is great, but the report in itself is not enough. We have to implement it, and we still have a lot of advocacy to do for this report to be implemented.
Pour que ce rapport soit mis en œuvre.
In Africa, women represent more than 50% of human resources. According to some estimates, they contribute 70% to agricultural work and are responsible for 60 to 80% of the food produced on the continent. Investing in the health of the woman is to invest in development.
Africa, and especially my country coming from a post-conflict, there are many priorities. But I always say on a daily basis that the subject of life and death, the subject of mothers dying in childbirth, the subject of children dying in birth, it's a serious impediment to our growth. We lack being a healthy nation, and a healthy nation definitely is a progressive nation. So our leaders must determine what is a priority and how to go about fixing it.
The World Health Organization first seeks to widely disseminate this report. The WHO Africa office will then bring African governments to rethink their policy of women's health. To achieve this, it can count on a strong ally in the person of the President of Liberia.
Yeah, number one, we really have to distribute the report very widely. We have to show to people, to governments, that there are so many things that could be done to improve women's health. So we need to have good governance. I mean, the report came with very concrete recommendations about good governance, about putting policy in place which supports improvement of women's health, about empowering women, about multi-sectoral approach. Women's health is not just a Ministry of Health issue, it's a multi-sectoral issue. Ministry of Education, Ministry of Foreign Affairs, Ministry of Economy. I mean, every ministry has a role to play, the society, the community. So there has to be some multi-sectorality, so we have to work towards that.
African leaders are very, very much aware of this. African leaders have very strong commitment to improving women's health. This is why we've made so much progress to date. Funding has been a problem, and we continue to advocate for our partners to continue to support these programs so that women's health can be even more improved.
The report on the health of women in Africa identified 6 groups of interventions which, with an appropriate level of investment, can improve the lives of women in the African region. However, for these investments to bear fruit, they must be supported by adequate funding, especially from the government, development partners, communities, and women themselves.
L'offre médicale ou biomédicale, l'offre sanitaire, il faut
the medical or biomedical services or the provision of health care, well, this has to be adapted to the community. It is not just a system that is dumped to a given area. It is a given area that we know and for which we modulate, we adapt to the provision of health care. So what does this mean? This means that, first, we have to listen to women. One of the strongest points of the report was to give the floor to women, which is the first major step if you want to come up with the right answers, because you cannot have a good response if you do not include the persons who are concerned by the issues you are working on. So there is this articulation, this junction. The medical systems have to open up themselves regarding women's situation. They have to be sensitive in this regard.
This report brings out the issues of women. If women are healthier, how they can contribute to the development. But most of all, it's not for development that we have to improve women's health, but women's health is a right on its own. So they have the right to live. When a woman is alive, her children are alive, her community is alive, her society is alive. So this report tries to bring out the big role that women are playing in Africa, in our communities, in our societies.
Malaria is, with maternal mortality, a major health problem in Africa. In Monrovia, in addition to the report on the health of women in Africa, WHO launched the Global Malaria Report 2012. This report indicates that positive results have been achieved over the past decade in the fight against malaria in the world. Interventions have had an impact in countries with high transmission. During this period, 1,100,000 lives have been saved, among which 58% in the 10 countries bearing the greatest load. Unfortunately, these efforts are slowed down due to declining funding. For example, the number of LLINs distributed to endemic countries in sub-Saharan Africa fell from a peak of 145 million in 2010 to 66 million in 2012. According to estimates, between 2011 and 2020, more than $5 billion would be needed annually to achieve universal access to malaria control interventions in the 99 countries where transmission persists. However, the total funds available globally remained stable at $2,300 million in 2011.
12 pays dans la région africaine ont pu réduire de moitié
12 countries in the African region were able to reduce malaria-related cases and deaths, and 9 countries are on track to achieve MDG 5, which consists in the reduction of 75% in 2015. Yet, there are still several challenges, especially the adequate funding of malaria-related programs. As you know, there is an important financial gap to reach the universal coverage of the interventions that proved successful. So this financial gap is a risk. Another risk is related to the efficiency of the interventions that we have to preserve, but also monitor, especially resistance to insecticides and resistance to anti-malaria molecules.
Aux insecticides et la résistance aux molécules d'antipaludiques.
The path to the total elimination of malaria and maternal mortality is still long. Reports on malaria and the health of women recommend policymakers to maintain or increase funding.